Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. You can also visit to playlist. In the playlist, I have provided all the topics so far we have covered in a very systematic order, so that it is very convenient for the study purpose. Okay, so we are looking at the basics of autism. In the last class, we have seen approach towards a case of autism. So today we will look into the diagnosis of autism in the present day scenario. Okay, we are not talking about Ayurvedic diagnosis here. We are talking about the diagnosis that is mentioned in the contemporary medical science. So when you go for the clinical diagnosis of autism, the diagnosis of autism in the contemporary medical science is basically on the DSM, Diagnostic and Statistic Manual for the disorders. So based on the DSM, we will go for the clinical diagnosis. In the DSM, actually, there are different facets are there. One of the facet is a deficit in social developmental milestone, language milestone, and as well as communicational developmental milestone. This is one thing. Second part is restrictive and as well as repetitive behavior. Third facet is insist for the sameness. And fourth one is restricted interest. So now we have to look into these four facets, and accordingly we have to diagnose the autism. So different scores will be given based on this: deficit in the social, language, and as well as communicational problem, restrictive and repetitive behavior, how much it is, and insist for the sameness, how much it is, and restricted interest is in to what extent. So based on this, we will go for the diagnosis of the autism, that is DSM criteria methods. Now, diagnosis of the autism can be also done by some other methods like administration of some of the psychometric tools. We can also go for the administration of different psychometric tools. Now, we have got different psychometric tools which are required for the diagnosis of autism. Some of them are CRAS. CRAS means Childhood Autism Rating Scale. Another is called as ADOS, that means Autism Diagnosis and Observation Schedule. Third criteria or tool is ADI-R, that is Autism Diagnosis Interview. Okay, Autism Diagnosis Interview. Then ISAA, that is Indian Scale for Assessment of the Autism. The last one, that is ISAA, so that is usually used in India, that is called as Indian Scale for the Assessment of Autism. The first one, CRAS, that is Childhood Autism Rating Scale, and this has got the specificity up to, that means up to 80% to 79%. So this is looks accurate. Okay, now one thing you can observe in all this scale, that is a letter A will be there, isn't it? So that's A stand for autism, just for the remembering purpose I am telling. CRAS, Childhood Autism Rating Scale, ADOS, Autism Diagnosis Observation Schedule, and ADI, that is Autism Diagnostic Interview, and ISAA, that is Indian Scale for Assessment of the Autism. Now we have got some other diagnostic scales also is there, but is MCHAT. MCHAT is also very commonly used screening method for the diagnosis of the autism. That details we will see later. Now come to the investigations now. Now what are the common investigation that will go in a case of autism? Number one is evaluation of the hearing and as well as vision. So that is must and should. Evaluation for the hearing and vision. So that is must and should. Okay. So now here TFT. TFT means again we know the thyroid function test. It should be also mandatory here. It should be done because hypothyroidism is the most common preventable cause for the mental retardation in India. Okay, so many times the symptoms of autism may be confusing with the symptoms of hypothyroidism leading to mental retardation. So it has to be excluded in the beginning. Number one is you have to go for BERA test, okay, for the hearing purpose, and also you have to go for the vision test because the patient is having more problem with the hearing, and also patient is also having more problem with the eye contact and all those things. So for the safeguard purpose, so we have to first exclude these two things. And we should ensure that there is no any hearing problem, there is no any visual problem. Later, you exclude the possibility of autism like symptoms due to mental retardation by hypothyroidism. Third one is we have to go for anemia workup. So anemia should be excluded. Then lead levels. Okay, many times anemia may lead to loss of concentration or loss of mental stability, etc. Then lead levels has to be seen. Lead levels. Okay, so those children who are having the habit of eating pica and all, so possibility of the lead poisoning is there, and this lead poisoning may lead to so many psychological symptoms. Then you have to go for EEG. EEG is required to exclude some of the convulsive problems which may be there because of some of the structural or some of the other problems related to the brain. So if at all there is a history of seizure, okay, so then definitely you have to go for the EEG. Otherwise also it is better to go for an EEG to make a conclusion that there is no any abnormal electrical discharge which is taking place. So this is helpful to exclude the encephalopathy-like conditions. Now, another is neuroimaging. Yes, neuroimaging should be done. MRI like investigation should be done. Again, this excludes so many possibility of existing some of the structural problems related to the brain. Then again, some of the other things that you have to observe along with the investigation is you have to look into some atypical regressions, epilepsy, microcephaly, neurocutaneous markers, and abnormal neurological findings. So these are the other actually the differential diagnosis we can say. A patient is having any patient who is having some neurological problem. So you are looking at neurological problem, but that patient has also got some atypical regression. See, regression of the milestone is one of the very important symptom in any of the degenerating causes. Okay, so developmental regression, that means already attained developmental milestones get lost. Okay, so that may be possible in autism. Actually, one of the autism spectrum disorder, that is a Rett syndrome. So where we find the regression of the milestones. Okay, so that has to be observed. Then history of epilepsy, that has to be seen. Chance if there is clinical examination shows microcephaly. Okay, then any other neurocutaneous markers, because tuberous sclerosis or maybe Sturge-Weber syndrome, tuberous sclerosis, neurocutaneous, that is neurofibromatosis type 1 and type 2. So this may be also sometimes the cause for some of the mental problems. Okay, so such type of problems. So that has to be excluded. So these are all the important investigation that you have to conduct in the face of the diagnosis. So in the next class, we will go for the differential diagnosis of autism. So till then, goodbye. Don't forget to subscribe my channel and also please give your valuable comments. Thank you very much.